So we've heard a lot about IVF. We just want to know what IVF is trying to help. What is the problem today with females and maybe males?
Well, IVF can help treat infertility in patients who have blocked or damaged fallopian tubes, removed fallopian tubes, male factor infertility, endometriosis, decreased sperm count, inability of sperm to penetrate or survive in the cervical mucus, ovulation disorders, premature ovarian failure, uterine fibroids, genetic disorders, or unexplained infertility. People with these conditions can have trouble conceiving naturally, so IVF can help these couples have a healthy baby.
Okay, so now we're going to take it outside to Kelly Jonas, who's going to tell us about some of the assumptions that people make about IVF and some of the biases that people think of when they hear the word IVF.
Well, Julia, one assumption that might be made would be the cost of the procedure. Most people will probably jump to conclusions since the price is very expensive. $12,000 for the procedure itself, and then the medication can be $3,000 to $5,000, which is very expensive. Yeah, I know. Another assumption people might make is the probability of it always working out. They may think that it always works out, but really, for women with top chances, their chance of IVF actually working is only 40%, where a majority of women, the success rate is only 20 to 35%, which isn't very high. According to many known sources, IVF is not the first option for conceiving a healthy baby outside of the womb. Most scientists suggest that you use prescription drugs, like fertility drugs, that will help some conditions that you might have with childbirth. There are other safer options that you can use, and cheaper too, but you should talk to your doctor to find out what's best for you and what would work with you. Hey, so Julia, based on what we've heard outside from Kelly Jonas, what are some of the social implications on IVF?
Well, Holly, I think this procedure would be very hard to explain to family members and friends if they aren't educated on the topic, right? But I don't think it would be frowned upon today. However, some people before thought it was a mysterious act known as test tube babies, which I think is totally irrelevant. But Louise Brown was the first baby conceived outside the womb in England in 1978.
Yeah, that's very interesting.
Very interesting.
So, Julia, we went over the social implications, but what do you think are the ethical implications of IVF?
Well, Holly, I think one ethical implication might be the pain that comes along with the procedure of such as ovarian hyperstimulation syndrome, OHSS, is another common disease that comes along with IVF and wanting to get IVF. But another problem might be the separate drugs that are used to stimulate the egg's production, and this is very sickening. It can lead to stomach pain, nausea, vomiting, and swollen stomachs. So I think that's just the downside to the ethical implications.
Julia, do you think that IVF is a satisfactory solution to infertility in patients?
Yes, I do indeed. This is a satisfactory solution. According to our sources that I have been searching before I came here, it works, but it's very expensive, and there are side effects and risks to IVF.
Like everything.
Yeah. It's also not the first option to conceiving a healthy baby. For example, people will take fertility pills / drugs that are cheaper to IVF.
Now, what is your personal stance on IVF as a whole?
Well, my personal stance on this is I think it's very good for people who cannot have babies because of their medical conditions. But I also think if there's an alternative, it should be the first choice for someone who doesn't have enough money or have problems,